Hi, today I'm going to discuss with you Cauda Equina Syndrome, or CES for short. What is Cauda equina? The spinal cord passes from the neck down to the lower back and usually in most people ends at L1, or the first lumbar segment. When the spinal cord ends, it fans itself out as the horse's tail in Latin, or the Cauda equina. These are a bundle of nerves that exit at this first lumbar segment. The job of the Cauda equina is to provide function to the bladder, to the bowel, and to the lower limbs. Cauda Equina Syndrome means compression of these nerves, or this bundle, as they exit at L1. And there are several reasons why Cauda Equina Syndrome may occur. So what are the causes of Cauda Equina Syndrome? Some of the causes include disc herniation. This is the most common cause. However, other causes include arthritis, a tumour in the spine, an epidural hematoma or a post-operative hematoma, or a spinal infection. But it should be known that these causes are not an exhaustive list, and other causes can contribute to Cauda Equina Syndrome. So what are the stages of Cauda Equina Syndrome? Although as physiotherapists we check for red flags such as saddle paresthesia, bladder or bowel disturbances such as urinary retention or sexual dysfunction, some of these are actually end-stage signs and symptoms of Cauda Equina Syndrome, and by that stage it may often be difficult, if not impossible, to reverse these symptoms. Therefore, Cauda Equina Syndrome is actually an evolving process, and by screening for these signs and symptoms, us physios endeavour to lessen the unavoidable. If the patient is mobile but experiencing back pain, bilateral radiculopathy, or pain and paresthesia in the lower limbs or in the genitals, the alarm bells should start to raise. An MRI scan should be performed at the earliest convenience, if not immediately. And if the patient complains of complete loss of saddle anaesthesia, so unable to feel anything in the anus or vagina or penis, or there is sphincter tonal changes and function, this is an emergency. The aim here is to reverse these issues and to restore function. How does a physiotherapist assess for Cauda Equina Syndrome? A full subjective history and screening should be conducted as soon as possible. Questions that can be asked include: has there been any recent surgery? Is the patient suffering from night sweats? Is the patient experiencing any of the symptoms listed earlier, such as saddle paresthesia or bilateral radiculopathy in the lower limbs, among other symptoms? The physical examination should then be conducted, and that should include the performance of a straight leg raise and assessing for lower limb reflex changes, dermatomal and myotomal changes in the legs. Why does it matter? The scale and the impact of claims for negligence against clinicians treating people with Cauda Equina Syndrome is becoming more prevalent. It is therefore important to screen accurately and thoroughly and avoid being embarrassed by asking all relevant questions, including regarding sexual dysfunction. Many cases have arisen whereby clinicians have not asked such questions, which may actually be a problem for the patient. But if the patient isn't given the opportunity to relay that information to the therapist, it may then be too late. So early detection is key. And if you suspect Cauda Equina Syndrome, get that patient sent for an MRI scan as soon as possible. Or if their symptoms are severe and likely that they have Cauda Equina Syndrome, blue light them to hospital. It is better to be safe than sorry from the patient's perspective to avoid irreversible change, and from the clinician's perspective to avoid a case being made against them.